Thank you for joining us again. It's my pleasure to welcome Karis Grounds, Vice President of Health and Community Impact at CIE San Diego. Karis, great to have you with us.
Thanks for having me. Really appreciate being here.
Absolutely. Well, why don't we begin by starting at the start? Tell us a little bit about yourself personally, professionally, and then about your organization, because many people may not be familiar with it.
Absolutely. So again, my name is Karis Grounds. I am the Vice President of Health and Community Impact. A little bit about my background. I'm a native Californian, San Diegan, born and raised in San Diego, although I lived in Seattle for almost 15 years. So have been mostly West Coaster. I have a background in public health. So I was working in kind of sociology and public health as most of my background, education a little bit, did international health, and really saw the kind of issues that were happening around public health issues, specifically with refugee resettlement. I was doing some work working specifically with refugees in San Diego and the need for public health awareness and kind of support. So I went back to school and have been at 211 San Diego actually for 8 years. I primarily worked with kind of healthcare organizations in transitioning to social service programs that were more around holistic care. And so my background really was like transitioning out of healthcare. How do you get people plugged into the community? And so that kind of started as my journey at 211 San Diego, and then has evolved into what we call the Community Information Exchange, which is been around for actually almost 10 years now. And it really started through a group of thought leaders locally in San Diego that were trying to address an issue around homelessness in our downtown San Diego, where individuals were being transported via EMS and going to jail and kind of accessing a lot of resources, shelters, and the hospital, and they weren't being coordinated. And so a bunch of thought leaders came together and were like, hey, what if we started sharing data about these people, asking if they were okay to have their information shared, and started coordinating care a little bit more effectively and efficiently together. And so that's really where CIE started. It's evolved a lot from 10 years ago, and I've been part of the journey on kind of, I've been at the prime of social determinants of health, kind of coming into this space and thinking about how healthcare information and technology and interoperability and all this work is kind of coming to a head as we're trying to think about patients and people care a little bit in a more holistic way. So that's really some of my background. And so I get to lead the local work that's supporting San Diego's Community Information Exchange. And then I also lead in collaboration with a few others, our national work. So a lot of CIEs are being replicated across the nation. So we mentor and publish documents that kind of leverage our local best practices for national use and standards.
Wonderful. Can you just clarify for me, and I may not be a good listener, but do CIE and 211 San Diego, are they still connected as organizations?
Yes, yeah. So CIE is kind of 211 San Diego is the steward of the CIE, we call it. So we have a local governance structure that's kind of leading our Community Information Exchange. So 211 is kind of I work at 211 San Diego and kind of support that department or program that's really leading our collective work as a Community Information Exchange.
I see. So they are interrelated. Okay, great. I just wanted to make sure I understood.
Absolutely.
And how, I know it's hard to probably quantify, but can you give us a sense of how big CIE is, either in terms of the number of community residents you touch, or your interrelation with other agencies or organizations? Give us kind of a sense of how big the scope is of what CIE does.
Sure. Yeah, so currently we have about 240,000 people that have consented in to have their information shared. So CIE's Community Information Exchange is really like it's a collective, locally stewarded information sharing infrastructure that allows for individuals to consent to have their information shared. And then multiple organizations currently have about 108 organizations that range from healthcare, like health plans, hospitals, federally qualified health centers, to community-based organizations like homeless service providers, food banks, multi-service sector organizations, older adult services. So we have kind of a conglomerate of organizations that are part of it. And different organizations are either contributing data into the information exchange. So they are logging into the platform and entering information, or we do bi-directional data sharing through interoperability, where we're actually ingesting information about an individual. So once an individual consents in, the people that are supporting them, like a case management service or a government service, they can look up that person's profile and based on role-based permissions, view information to provide more informed care. So the goal of the CIA is really trying to shift the way that we're providing care to a more trauma-informed and kind of collaborative way, instead of having people retell their story over and over again, and really try to address root causes instead of kind of surface level issues that we see kind of going on.
That's wonderful. So tell me a little bit, and I know, there is great need in all communities in the United States. What does the landscape of need of your community look like in the greater San Diego area? And how do you try to tailor what you do to what the landscape is like on the ground?
Absolutely. I think that's where community information exchanges are pretty unique from that perspective, in the sense of we are pretty rooted in the ground. So our local governance structure allows for us to get input by the various organizations and the people that we're serving directly to make those informed changes and decisions. And so, but within nature, we're able to really be tied to what's happening locally, or we can start looking at zip codes, or we can start looking at social needs, the populations that the various populations by ethnicity or race, and kind of do some of those breakdowns and start making better decisions as a community on how to address those issues. And I think that the landscape, I mean, there's some things that apply, I think, across the nation. So anything from, I think specifically in healthcare, we're shifting more towards like homelessness as a way to be able, okay, what are some tangible things that we know are directly rooted to healthcare outcomes? And, homelessness is one of those things, nutrition. We know that there's a lot of indicators around even older adults, like some of, ADLs, those kind of things that could be important to be able to understand to support them. So we're fairly tied directly to those needs because people are sharing their data and having that kind of inputting their information. We're collecting enough information to be able to kind of create that entire story instead of just like a little piece or a glimpse into that person's story. And so that's what the CIA is really valuable in being able.
Wonderful. So how did you and your colleagues figure out how to create data sets, how to kind of shepherd the information so it wasn't a million stories told a million different ways? In other words, if Mrs. Smith presents herself to you in some way, and you're trying to make sure she's connected to services, you're trying to understand her personal context, how did you discipline the documentation and logging in of data so that you don't have stories told countless different ways?
Mm-hmm. Yeah, and I think that that's an evolution of things we're kind of figuring out. I know, data sets, I think we've been set up well from a healthcare lens on the way that like meaningful use, HL7, the way that coding and standards kind of operate. Social services really don't have a lot of those standards. We're kind of, we've been around for a long time, but we don't necessarily, we haven't had the infusion of investment and money to kind of standardize some of the services that healthcare has. So we've created a lot of resources and tools like data dictionaries. We've looked at kind of pulling in multiple different organizations by sector and looking at what tools are existing, what's already out there in evidence-based tools and screenings and things like that we're able to really apply and standardize a lot of that language. So we're trying to create a shared language within CIE. We actually have something we call it CASCA tool, but it's really a tool that looks at people from a crisis to thriving state and looks at 14 different domains and looks at things like immediacy, like how soon do you need something? Do you need housing now? Or do you have an eviction notice? Or do you live in a house and you need things repaired? Or do you have barriers? What barriers or supports? If you're on parole or you have bad credit, it's going to make it really a lot harder for you to get housing than someone that doesn't have those issues. Or if you have some, you've already used resources in the community, it makes it So it's easier for you to navigate what's available. So a lot of those kind of conditions, or almost the makeup of what healthcare thinks about, like BMI or A1Cs, what are all the makeup pieces of that? We've tried to collect that on the back end from a social service lens to better assess how to almost intervene or prescribe orders or do whatever it needs to do from a social service landscape to be able to support that individual.
And have you created, I know you mentioned vocabularies, have you created vocabularies so that there's some consistency in reporting different individual situations?
Locally, yes, we have. And I think, we've been collaborating with Gravity Project. So the Office of National Coordinator, as I think many people in the interoperability space know, Gravity Project is coming out with some new ICD-10 codes that help to categorize social needs. And so being able to kind of align with what's happening from a CBO lens or community-based through our 2-in-1 LA taxonomy is another great resource to be able to kind of align some of that language. So we're trying to align it with those with existing or to come resources for healthcare. But a lot of that's, it's still in development. Locally, we have a language that we're kind of creating and communicating across our local partners and organizations. But being able to kind of think about that rippling across the nation is where we want to move to.
Okay. 2 questions. 1, what have been some of the biggest challenges in all of your work? And 2, what have been a few areas where you feel you've really gained ground and made some nice advances?
Sure. And I can speak to maybe specifically around, I don't know if interoperability, and I guess it relates to both pieces of work. Like, it doesn't matter if it's interoperability or community information exchanges in general. But I think that there's a lot of things, like our challenges include the standards, as you're mentioning. I think there's a lot of work that there's definitely not alignment on standards from a lot of perspectives from a community-based organization. We all have our own siloed kind of sectors of experience or knowledge. And so you're not just solving for one system, you're solving for like a bunch of different systems that operate differently and have different funding. So I definitely think agreeing on, even in public health, I think there's probably aligning on standards around language is still a challenge to be able to, how are we aligning on even male, female, or women, how are you even defining a gender or ethnicity and things like that are kind of challenges around that space. Capacity building, I think that there's still, being able to elevate everyone to that kind of level of being able to use technology and information to be able to share that with, how does that change your informed decision making? Like, what does that mean? So I think there's a long way to go from the standard to the actual implementation of a lot of these things. And so, we're just figuring out a lot of these standards, like how does that apply into practice, is still being developed and creates challenges for it to be leveraged in a meaningful way if it's not necessarily applied yet. And then
so a few areas where you made some gains.
Yes, I think that, I think our local infrastructure allows, with our governance infrastructure, I think we're, when we're thinking about equity, where community information exchange infrastructures have the trust and transparency that's needed for us to kind of move to the next level around addressing some of the issues we're seeing in data sets or issues we're seeing in technology, having representation across sectors as well as for those with lived experience, allows for us to be able to kind of move in ways, be able to be local, to your point, applied to the ground. Like, those kind of things are opportunities with CIE, the infrastructures and the way it's built can kind of be leveraged for those local capacities. And then I think that, we've seen a lot of use case examples of where we can be responsive to policies and initiatives that could be federal, but then as they're rolled out locally, we built the CIA, we built like a pool instead of we built an ocean instead of a bunch of pools. And so if you think about data sharing and we just built a bunch of pools and not an ocean, then you're going to have to create more and more siloed efforts. And so being able to build that ocean, we're really being able to really address the different needs, but not necessarily have to create an infrastructure to support all the different initiatives that are coming down the line. So that's been a great opportunity for us, is being able to leverage that infrastructure and kind of that community development and build to be able to do more and more things.
Great. How do you interrelate with, for example, San Diego Health Connect, the broad HIE? How does your work overlap or touch theirs?
Yeah, so we've been in long collaboration with our health information exchange called San Diego Health Connect. So we currently do information sharing. So in the HIE, there's a tab for the community information exchange. So there's actually visibility between our two, our network. So for those that are consented in and have information, there's that opportunity in health information exchange to be able to actually view information into CIE and do like a single sign-on into the CIE to be able to see that social information, as well as provide some of those details in there. And so we've looked at some research opportunities and some, looking at cost savings and things like that that have been really effective with HIE. But kind of CIE is kind of the opportunity with HIE to be able to kind of look at that whole person when you have the healthcare side and then you have the social service side. We really see that as a vision for the future to be able to kind of combine those two, as well as the county. We actually have a Connect Well platform, which is our county's way of sharing information across their system to be able to actually look at it from a holistic lens. Once you have county benefits and services as well, you can really look at the holistic needs of a individual or the systems of care.
Absolutely. Are there any other community information exchanges like yours, or are they all different things doing different things?
So that's a great question. I think that, CIEs are being stood up across the nation. So we're definitely not the only one. And we have a toolkit and we publish a lot of our resources to be able to have it replicated. So I've seen it in like New York, Austin, Seattle, in parts of California. There's more and more kind of being stood up. So they're populating across the nation. But San Diego, I think, is unique in the sense we've been at this for a long time. So when you look at other communities, you're like, oh, well, you guys we've been trying this. We have a lot of lessons learned. We definitely haven't done this right. But I think what's exciting is we're seeing other communities kind of step in and learn from what we did and probably start 10 steps, 20 steps ahead of us and build a system that could progress way quicker than us as they get everything built up and start thinking through it. So there's definitely a lot of opportunities.
That's wonderful. We only have a few minutes, but what are elevator speech? What are a couple of the biggest lessons learned that you find yourself sharing with other CIE leaders as they begin to move forward?
Well, I mean, one of the things is, and maybe this isn't the right conference to say that, but technology is like the mode in which we're sharing. It's just it's really
just the plumbing.
Yeah, it's just the plumbing, like the people and the processes, and like we say, our governance structure or stewardship of it is the most important thing. And I even think about like the way interoperability works now. There's a lot of the piping could be there, or there's legally information could be shared, but it's really the trust and transparency that makes things stop or not move forward. And so really thinking about the people, processes, what infrastructure, like think about that before you start looking at technology and interoperability, really starting with like, what do we need? What can we leverage? I think one of our lessons learned was like, we didn't come in thinking about a platform. We looked at what are the existing systems in place with locally in our community that already have a lot of use or could be leveraged. And so that was anything from our EMS platform. A lot of our EMS service providers use one platform to document transports to the hospital or when they're, and so could we plug into that? Or a lot of our homeless service providers are already using the homeless management information system. Can we plug into that? How do we leverage HIE? How do we leverage the county information sharing system? How do we leverage food banks that support multiple social service organizations? So we really tried to think about what's already working in our community and not expect everybody to adopt one platform. It's really about meeting organizations where they're at and figuring out how we can kind of plug and play what's already existing and really support the local infrastructure that is attempting to do a lot of the things we're trying to do as a CIE.
Wonderful. And what would you say our audience is primarily people in healthcare systems. What would you like them to know about this work?
I think there's definitely healthcare is invested and interested in this. And I think there's a solid interest and effort to understand and support it. And I think it's how do you start working directly in community? I think there has to be a shift or transition. I think CalAIM, and I know that's something that many consists of the California kind of consortium of that. Medicaid is trying to kind of rethink about that and know that these type of kind of social determinants of health are really, really important to a whole person's needs. And so how do we start working more closely with community-based organizations? How do we support capacity building? How can you kind of flip the script and shift those power dynamics a little bit where CBOs can potentially support? How do we think about them as supporting your members in a more comprehensive or holistic way? And so I think, figuring out ways that we can have shared tables and shared ways of learning about it and supporting really the capacity for them to step up and really meet the needs that I think healthcare is wanting them to help and serve in a meaningful way. And so just kind of setting more stages to be able to hear directly from community-based organizations and trying to support CBOs from a capacity building perspective would be really, really helpful in kind of moving in this new phase of whatever this policy, the way that policy advancements are going and the way that this work is going around equity and inclusion. Like, I think it's exciting. It's an exciting place to be.
Yes, absolutely, it is. And very last question, what do the next 2 years look like for you?
Oh gosh, a lot of work. I know if you guys are interested, go to our website. We're doing a few publications. As I mentioned, we're doing a data equity framework publication that really looks at what are the drivers around sharing data, and then what are the use cases, and how do you think about it moving to a liberating model of data sharing. So we're doing a bunch of publications that help to look at a vision for the future, and then how do we really apply that. So in the next couple of years, we'll be internally kind of using that as a guiding post and then sharing with other communities as they're reflecting on what type of systems do they want to build, and how do we start thinking about data for a common good perspective, and really supporting kind of local data intermediary role. So how can we use this data to inform the way that our communities are accessing services, and use it from a policy perspective locally to really elevate some of the issues we're seeing on the ground level.
Wonderful. Well, this has been absolutely terrific. Oh, please tell us what your website is for those who don't know.
Yes, so go to cisandiego.org. We have a local San Diego link and then a national link, and that's where a lot of our resources are available. Also in the news is another link at the top you can see, and that's really where a lot of our publications and toolkits are kind of coming out. You can sign up for our newsletter there and get kind of updated on the various things that are going on. And we have meetings and we host national events to be able to really bring communities together and learn from one another.
Wonderful. Well, thank you so much, Karis. I've learned so much. I want to wish you and your colleagues absolutely all the best. You're doing tremendous work. It's so needed, and I just think it's wonderful. So thank you for being with us.
Thanks, Mark. So great to talk to you. Thanks so much.
Absolutely. Thank you so much. This concludes this session, and thank you all to all of you in our audience.